All right, I'll be quick. This is a long video, so if you just want the highlights, we're going to be talking about these few charts. Long story short, the United States is spending way too much for worse health outcomes per capita. Universal healthcare is cheaper than the system we have in place right now. We can have longer life expectancy and ensure every person in the United States while saving money. We're going to go through that. We're going to look at some of the websites that you can use in order to look at this sort of data. And then at the end of the video, we're just going to talk about why it is essential for us to implement universal healthcare. Okay, let's get into the details. All right, let's start looking stuff up. U.S. healthcare spending graphics. Let's just look up some images for now. So the Kaiser Family Foundation is actually a very legitimate source. It's pretty reputable. What is this one saying? U.S. spending on healthcare changing over time. You have the total national health expenditures and constant 2023 dollars. So that's just adjusting for inflation. And what we can see here is health expenditures were typically growing at the rate of inflation until very recently. Right here around 2019, so COVID, we saw a spike in the spending on healthcare, and inflation went up simultaneously. But then inflation stagnated and the price of healthcare continued to climb. That's not good. That means it's taking up a bigger portion of our economic resources. Here's the national debt. Oh no, this is the national health expenditure as a percentage of GDP. Okay, that is pretty significant. So what that means is if you're looking at this line ought to stay flat. If this is going up, that means that health expenditure is taking up a bigger portion of the United States economic power. Where GDP is gross domestic product, and what that means is it's essentially all of the goods that are traded and sold within the United States. It's a measure of how large the United States economy is, and typically it's thought that GDP going up is a good thing. Average annual growth of GDP per capita and total national health spending per capita. So GDP is green and health per capita is blue. This is just saying the same thing as this chart is putting it in a bar chart though. The average annual expenditure growth rate for select service types. What are the service types? Hospital, physician and clinics, retail prescription drugs. Okay. And this is the growth rate. So we're seeing prescription drugs since the 80s have been one of the big growth areas. Hospitals are actually going down in their amount growing per year. This is interesting. Per capita out-of-pocket expenditures. So this is how much you as the consumer are paying per person. So it doesn't matter how big the United States is. What matters is that this is how much it costs the average person across the United States. And that just keeps going up. Constant 2023 dollars. That is adjusting for inflation. So that's why it's exactly equal here, because in 2023, when this chart was made, that is how much the total out-of-pocket expenses were per person. And the fact that these diverge as you go back in history means that the average American is paying more out of their pocket towards healthcare. What else should we be looking at? Okay, private insurance, Medicare, and Medicaid. Cumulative growth in per enrollee spending by private insurance, Medicare, and Medicaid. So what this is telling us is that we are spending more on healthcare even if we're insured in the United States. Average annual growth rate of spending per enrolled person in private insurance, Medicare, and Medicaid. So that's just another growth chart. Total national health expenditures by public and private payers. During COVID, public payers went up, and it looks like it never quite separated as much as it used to be, but the private expenditures pay more. Local, state, and federal expenditure on public health. So what we would expect to see here is significant increases in federal funding during the emergency of COVID. And this is showing us in billions. Oh, this is a pretty bad chart. It's hard to read. Net cost of health insurance and government administration as a share of total health expenditures. Annual change in price and quantity indexes of health services. Okay, these charts are getting a bit obscure. Let's look up some other stuff. Okay, this is a good one right here. And it is by Statista. Statista uses official sources in order to compile their own charts, but let's find the official source for that. This is the U.S. healthcare per capita compared to other countries, and it's only 2021, so we can look up probably 2023. So, U.S. healthcare per capita. Okay, KFF again. There's probably another one. Let's use this one for now. Okay, this is not comparing other countries. This is just showing per person per year how much healthcare is continuing to go up. That's quite interesting. I haven't seen this chart before. It just keeps growing so much faster than the average pay is going up in the United States. I've seen this one before. There are a few of these. Let's find a recent one. Let's say 2023 KFF. No. We're looking for a chart like this. And that's an old chart. Where? Let's say 2023. Let's look at this website. I bet you it'll have something. Oh, this is where we just were. Great. Let's compare it to similar countries. That's by state. Now, there are other search engines to use for material like this. I am just using Google. Stuff like this is always interesting. Oh, how the US compares to other countries. So every time you see a chart like this, you have, for instance, this chart, GDP per capita and health consumption spending per capita, US dollars 2023, current price and PPP adjusted. Oh, PPP stands for price per person. Wow. So every time that you see a straight line like this, that's called a regression line. That line tells you the average of all the other countries. So on the x-axis here, we have GDP per capita, and on the y-axis, it looks like we have the healthcare spending. So you can see the United States GDP per capita is 82,697, and the health spending per capita is 13,432. What this is telling us, because it's so far above the line, is that healthcare spending per person as a proportion of GDP is significantly worse, or we spend more as compared to how much GDP we're outputting per person in the United States. Being below the line is a good thing. So yeah, a country like this, Luxembourg, is, wow. So they're generating $140,000 per person in GDP per year, and they're only spending $7,234 per year on health insurance, or on health care per person. Okay, let's keep going. Here it is. Okay, so health expenditure per capita, US dollars 2023, current prices and PPP adjusted. Let's just make sure that PPP is per person per year. PPP adjusted definition. Purchasing power parity. I don't know what that is actually. A measure of the price of specific goods in different countries and is used to compare the absolute purchasing power of countries' currencies. Okay, that's quite interesting. Let's go back to that chart. Okay, so this is kind of ridiculous. Almost all, if not all, of these other countries below the United States have universal health care. So that means that their citizens don't pay anything when they go to the doctor. It's all covered in taxes. The United States healthcare per capita is $13,432 per person per year in 2023. Comparable country averages are almost half. With Switzerland is trying to creep up on us, but they're not even coming close. Look at that. All of these countries have longer life expectancies and lower morbidity rates than the United States. Morbidity is just how people get, or the number of people getting sick with certain conditions. Wow. Bunch of information. Yeah, that chart right there, that is telling. Let's look up US life expectancy. US life expectancy 2024. Let's do overtime. Overtime compared. Yeah, this chart is interesting. Look at this. Okay, so in 1980, the United States was in the middle of the pack. You had Austria down here, and Belgium and Germany that were below us. 73.1 years was Germany's 1980 life expectancy. The United States was sitting at 73.7. The best country at that time looks like it was Japan. That's not going to change. Then Switzerland, then Canada. But look at this. As you go towards the other end of this graph, the United States flattens out and just lags behind the growth of every other country. And look at this dip. This dip is so telling of the robustness of the US healthcare system. This is COVID-19 right here. This dip that you see in the United States, other countries all have dips too, but those dips are absolutely minimal compared to the life expectancy drop of people in the United States. We're paying more for this. Remember that. Then look, every country recovered. The United States recovered too, but every other country recovered right about to where they would expect to, and some of them continue to grow. The United States is still trying to get back to our high. In fact, our high is actually back here. It's in 2014. We've gone down in our life expectancy before COVID since then. Look at this. Comparable averages. And a lot of people would like to blame diet and lifestyle in the United States for our lower life expectancy. But that is not the full story. And that is just a terrible argument when you actually start looking at all these other countries and realize that the obesity epidemic has been spreading globally. The United States isn't even the fattest country in the world anymore. A really good way to show how much of this is tied to our healthcare is actually to look up maternal mortality rates. So let's look at that. U.S. maternal mortality rates compared to other countries. Let's look up images. That's infant mortality. The United States is leading the pack in the most infants that are dying during birth. That's great. But we want maternal mortality. Now, the United States is trying to push to force women to give birth when they don't want to. I think this is an old chart, but we can look at this one. Maternal mortality per 100,000. This is 2020. So this is quite interesting. The United States is the only country in the world where maternal mortality rates are actually increasing year over year. There is not much more indicative of a completely broken healthcare system than the lives of mothers who have just given birth are more at risk today than they were yesterday. Our healthcare system is broken. Let's find this with a different chart. Maternal health in the U.S. Let's see if this has anything. This is by Medium. I don't know who Medium is, but maybe they have a good source. Yeah, they're using an okay source, but this is an old chart too. 2015. Let's look up. Okay, we'll use Statista. They are pretty good. You can adjust your data with them too. Again, we're looking at 2020. Let me type in the year. 2024. Commonwealth Fund. Yeah, they're pretty good. Wow. Oh my goodness. Okay, this is also old. This is Oh, this is a bit better. This is 2023. Wait, maybe not. All country data except the US. The US are from 2022. Okay, so this is old as well, but look at this. If you are Black in the United States, your maternal mortality rate is 50 per 100,000. if you're a typical US citizen, you're 22, so less than half. Now, there are socioeconomic status issues with that to try to figure out what is causing that the most, but let me just tell you, with that difference, SES is not the driving cause. It's a racist system that underserves our black population in the United States. Yeah, look at that. White women, 19. I believe that Eastern Asians have a very low death rate too. Yeah, US Asian, 13.2 deaths per 100,000. So race plays such a significant role in our mortality rate. Let's keep going. Let's find one that's newer because the numbers have gotten worse. Maternal mortality crisis. That's the same chart we saw. Worldpopulationreview.com. Not familiar with that website, so let's not use it. You could use sources like The Guardian or CNN, but typically it's better when you're looking at this data to go to the source. No. Now what we could do, I wonder if the AI has the answer. US News. Oh man, news sources are so bad. Let's see. CNN. Is this the same article? US has the highest rate of mortality. Let's see. Continues. Is that the same article? It's not the same article. It's just telling the same story. Okay. Why am I not finding this? What about 2023? CDC. You can trust the CDC. Printed. PDF. Data sources, references, figures. That's just down at the bottom. Okay, let's go back. We have 2023 and look at images. I really would like to just show off how much worse it has gotten. No. $2020. Okay, just remember this number. 23.8 per 100,000 lives, or live births. And this is 2020. 2017. Yeah, look at that. So 2017. Oh, we were doing worse in 2017. That's, at least we've recovered a bit from there. According to this is Kaiser Family Foundation. Let's see if they have health and well-being. Overall mortality rate per 100,000. That's nothing to do with maternity, though. Let's type in maternity. Yeah, okay. Maternal, this is through 2017. And look at this. This is what I mean. The United States is going up. The trend line would look like this versus every other comparable country is going down. Every other country in the world is going down. Geez, I wonder why I can't find this for 2023. One more time. $2025. This is by the CDC. And it does not have a nice line chart. Oh, the WHO. They would be legitimate. Download. No, they're not going to have what I'm looking for either. Wow, I didn't expect this to be so hard. Just look up images one more time. Oh, we found it. Look at this. Kaiser Family Foundation. Maternal mortality rate, deaths per 100,000 live births. This is 2021. Anyways, 32.9 in 2021. Wow. And look at all of these other countries. 3.5 in Australia, 3.5 in Austria, 3.5 in Germany, 3.4 in Japan, 2.8 in the Netherlands, and 2.6 in Sweden. Like, these are moms dying after giving birth. Now, these are live births. That's important. I believe the United States also leads the world in the number of C-sections that we give. But yeah, so all of this going back to this very crazy fact that the United States is spending so much money per person on our healthcare, and we have every metric showing that our healthcare system is not serving to make us healthy. Now, I believe we were talking about obesity, so let's just look up obesity rates. Obesity by country. Here we are. That's Market Watch. We don't want to use them. Reddit? Nope. Daily Mail. But that's old. The Economist. Fat of the Lands. They do put the United States first in 2009. See, that is where the issue is. What we used to think of as the United States being the fattest country in the world is from old data. So Europe. This is Reddit. Man. By country 2024. Okay, this is, here, let's just look it up on PubMed. Obesity. PubMed is it's like Google, but for research articles. By country. And what we can do is only show articles that were published, let's say, since 2023. Diabetes. You know what? Let's just go obesity rate by country 2023 and look it up here. worldobesity.org. I don't know about this website. I've never used it before. United States. 10th. According to this website, the United States is currently sitting at 10th. That sounds about right to me. Wikipedia. Believe it or not, that's not a terrible source. It puts the United States at 16th as of 2022. wisevoter.com. This is probably not super... it might be legitimate. I don't know. But look at this. The United States... it's putting the U.S. at second, which is not very good. This is not a very good website. It doesn't even have... It's designed well, but the data is just hard to figure out when the numbers were published. Okay, let's not use this. By country, the United States is first again. By population. CIA.gov. It's a .gov website. Yep. Now, this is a website that I would relatively trust for their information because our taxpayer dollars are going to do this. These are 2016 estimates. So even by 2016, we can see the United States was not topping the chart anymore. WHO. In 2022, 1 in 8 people in the world were living with obesity. Worldwide, adult obesity has more than doubled since 1990. Blah, blah, blah. World Obesity Atlas. Don't want to download more stuff. CDC. Now that. No, it's only the United States, I bet. .eu website. And that's only Europe. Anyways, long story short, obesity is not the main reason that the United States healthcare costs so much. We're being ripped off. We're spending more than any other country. And we're dying. Look at that. 78.4 versus 82.5. 4.1 years from every United States resident is being lost. And it seems like there is some pretty big discrepancies going on depending on the color of your skin. It's not acceptable. And we can do better in the United States, especially for how much we're spending. Look at that. $13,432 per person per year is our expenditure on healthcare for worse health outcomes. We spend more on prescription drugs. The entire system's broken. But we can't just give up here. We have to come together and build a community, build a society that takes care of each other. When someone gets sick, they deserve a doctor. Healthcare is a human right, particularly in a hyper-prosperous nation. Healthcare is a human right. But anyone that gets sick deserves to be taken care of. It's just a matter of deserving it. And because we have come so far along with technological improvements and medical improvements, we've gotten to the point where the United States needs to establish healthcare as a human right. Now, it's actually cheaper to just implement universal healthcare, a single payer option, for quite a few reasons. Not the least of which is the reduction in administrative burden, where it is so freaking costly for the United States healthcare system to try to process all of these claims. We have administrative buildings bigger than the hospitals that they're administrating healthcare for. That's not something that you see in other nations, particularly not in nations with single payer systems. In those other countries, if you get sick, you go to the doctor, it's covered. No one needs to process anything except to make sure that the doctors get paid. In the United States, you still need to pay the doctor. You have all of that. You have HR, you have private for-profit health insurance. You have the drug companies. When you take a good like healthcare, where if someone gets sick and needs their life saved, they're willing to spend whatever they can to save their lives, the companies have too much power, and they use that power to charge obscene rates that are unacceptable in an ethical healthcare system. And you might be, or a lot of people complain that, you know what? Well, I don't trust the government to do this. But just think about who the government tries to put first versus who corporations will always put first. Now, the government's not perfect, but at the root of what establishes the government, it is recognized that the government serves the people. Corporations are legally obligated to serve shareholders first, beyond public interest, beyond their employees. The only thing that corporations will ever do is put profits before people. And that is why they are not the ones that we can trust to build our healthcare infrastructure and systems. We can do better. I expect more from us. The solutions are out there. Other countries have done it first. We can take their systems and implement our own and get rid of the things we don't like from the way that they've implemented single-payer systems. What we're doing right now is unacceptable. We need to come together as fellow citizens. We need to rise up and ensure that our society treats everyone with the human dignity that we all deserve, because we're all going through this together. And if you don't identify with that, well, maybe you're part of the problem. All of the fantastic technological and medical advances are only possible because society enabled a fertile ground for ideas to spread and for these companies to exist. Society can exist without these profiteering, evil healthcare companies. But these companies can't exist without society. So we need to stop putting them before the people that make up the society we live in. It is absolutely essential that we take care of each other, particularly in a case like this where we can eat our cake and have it too. It will be cheaper. We will save money while giving people health care when they're sick, ensuring that mothers are healthy when they give birth, ensuring that infants don't die. We can save money while doing all of these things. Society will be better and our pocketbooks will be better. We need to stop this facade of imagining that the solution isn't obvious. It is so obvious. It is right there. Death rates, spending per capita, life expectancy, morbidity and mortality, pandemic response. We have allowed corporations to step in with their interests beyond the interests of the people that allow them to exist in the first place. It's unacceptable, and we can do this. If you've made it this far in the video, I really appreciate it. Please like and subscribe. Leave some comments down below and tell me what you think. I'll try to respond to all of them. Have a great day.